Good afternoon and welcome. My name is Jennifer Bell. I am the president of the Dalla Public Health Alumni Association and a proud 2013 epidemiology MPH graduate. The Public Health Alumni Association, or PHAA, is a volunteer organization that promotes engagement and connection among the graduates of the many programs offered by the school. Before we proceed with today's presentation, we would like to acknowledge the traditional territories of the Mississauga of the Canoe Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples on which the Dalla School of Public Health now stands. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Confederacy of the Ojibwe and allied nations to share and tend to the rich resources around the Great Lakes. We also hereby pay our respects to all our ancestors and to our present-day elders. Today, we're presenting a pandemic edition of the annual CP Shah Award, in which we are recognizing not only the award winners, but the large number of our alumni who are medical officers of health and who have been working tirelessly over the past year and a half. There are over 50 medical officers of health in Canada who are Dalla graduates, and I think as fellow alumni, we can all be proud to count them amongst our midst. Speaking of Canada, we also have today a very special guest, and I will now turn the microphone over to Dean Staney Brown to introduce this most honored guest.
Great, thanks, Jennifer, and thanks to you and to the entire Alumni Association for getting us here to a really great place today. And it's I'm really thrilled with who our honorees are today. I'm really grateful to Dr. Shah for helping us start this award years ago, and I'm thrilled that we can attract someone of Dr. Tam's caliber. Before I introduce Dr. Teresa Tam, I'll just say, look, one of the challenges of public health is as long as everything's working, pretty much silent. You don't hear a lot about it. You don't see a lot about it. But when the ships are down, public health rises in prominence. And we've seen the importance of leadership in public health throughout this. And so, I'm really pleased to be able to introduce Dr. Teresa Tam, who's the Chief Public Health Officer of Canada. I think you've seen on TV her expertise, but also her grace. And although it's, I think everyone in true Canadian fashion always wants to be very mild and very modest about stuff, it's this type of leadership that's helped save countless lives. She works to protect both the health and the well-being of Canadians and has for over 2 decades now. She's actually a pediatrician with an expertise in immunization, infectious disease, and emergency preparedness, and global health security. And she's been Canada's Chief Public Health Officer since 2017, and is actually the first woman to hold the job. In addition to leading the country's fight in COVID-19 pandemic, she's provided national leadership in response to SARS in 2003, and with the World Health Organization committees for Ebola, polio, and MERS. And if you read her last report, you'd know she's a champion for health equity and has for a long time been a leader in Canada's efforts to address the ongoing opioid crisis. I'm sad to say I don't think will leave us anytime soon. She's a fellow of the Royal College of Physicians and Surgeons of Canada, and as befits someone who's now speaking today at a university, she's got more than 50 peer-reviewed publications. Dr. Tam, I'm really grateful that you can take time out of a very busy schedule to join us, and I'll turn it over to you now. Thank you for joining us.
Thank you, Dean Brown, and bonjour à toutes et à tous. Thank you for the kind introduction, and to Ms. Bell and Dr. Campisi for the invitation to join all of you here today. And I'm really excited to be here alongside so many esteemed colleagues, educators, and learners as we celebrate the achievements and contributions of the Dalla School of Public Health alumni medical officers of health. I would like to acknowledge that I'm joining you from the traditional unceded territory of the Algonquin and Anishinaabe people. Indigenous peoples living across Canada have shown tremendous leadership, resilience, and community collaboration in responding to COVID-19. As leaders and professionals in public health, it is our responsibility to continue to strive for respectful and inclusive partnerships with Indigenous peoples as we search for collective healing and true reconciliation. Donc, bienvenue aux nouveaux étudiants qui se sont joints à nous aujourd'hui. Je suis très heureuse que vous ayez choisi de poursuivre votre parcours universitaire en santé publique. Public health needs students like you, and I hope you'll be the flag bearers for transformative change as we move forwards. Over the past 18 months, we have seen many individuals, communities, organizations, governments, and sectors contribute to Canada's public health response to COVID-19. And despite the magnitude of challenges brought on by the pandemic, we have also seen opportunities to invigorate and improve public health, particularly through collaboration and partnerships. Medical officers of health across the country, including over 50 who are alumni of this school, have facilitated the spirit of collaboration and have built trust within our communities. You have been the leaders of pandemic response in different capacities and across diverse communities in Canada, working tirelessly to provide support, care, and information during a highly complex and ever-evolving period. Of course, I have to give a shout out to Doctors Lowe and Dalla. They are great colleagues that I've had the honor to work with. And throughout the pandemic, they have served their respective regions with exceptional leadership and compassion. And it is an honor to be here today in this celebration of their achievements. There have been many notable innovations and achievements in local public health units across Canada. To take one example, because I am very much striving to champion vaccine uptake, I've been particularly seized with incredible mobilization on the ground with mobile clinics, community outreach, culturally safe messaging to try and increase Canada's vaccine uptake. And we are, of course, some of the most fortunate and countries to have the opportunity to have the vaccine, and we are at the global forefront of vaccine coverage. And I've been following the works in different public health units, but including Doses After Dark in Peel, of course. That incredible day, Toronto Vaccine Day with Scotiabank Arena, that mega clinic. I was there, watching the 25,000 mark being crossed in terms of record-breaking vaccinations. And many of the local health units have partnered with occupational health departments, private sector, using hyper-local strategies to get us this far. There's still more ways to go, but you should all be very proud of the efforts that you've put in so far. It has been said that public health moves at the speed of trust. On dit que la santé publique évolue à la vitesse de la confiance. Nous le voyons sans cesse qu'il s'agisse de contre la réticence face à la vaccination des enfants, de lutter contre la crise des opioïdes ou maintenant de répondre à la pandémie de COVID-19. We know the importance of communicating clear information as well as combating misinformation. So I really appreciate all of you for taking on this role, maintaining professionalism and staying strong during times of adversity. The reality of public health efforts is that we typically work behind the scenes and are invisible to the general population. However, over the past 18 months, this has changed immensely, and public health is now center stage across public and private spheres. And it has really shown the role of public health and why public health matters, certainly in the emergency context, but really more broadly. And medical officers, health, nurses, epidemiologists, those modelers, logisticians, communications professionals, and so many others have all played a vital role in contributing to the broader response effort. Donc, la santé publique exige la collaboration et le travail d'équipe, non seulement dans notre domaine, mais dans tous les secteurs de la société. While we are all certainly looking forward to the days when this pandemic is behind us, we must not lose the momentum and gains we've made during these challenging times. This means we must continue to work hard to improve and strengthen public health systems, foster innovation to create and implement effective solutions, and perhaps most importantly, motivate, train, and continue building up a highly skilled, inclusive, and diversified public health workforce. La pandémie de COVID-19 a mis en lumière l'importance cruciale d'avoir un système de santé capable de se déployer et de s'adapter en période de crise, tout en veillant à disposer de la capacité à s'attaquer aux problèmes critiques permanents en vue d'assurer la santé et la résilience des populations. When the public health system has the capacity and tools it needs, we all benefit. So schools of public health, like Dalla, are really important in creating new generations of professionals that understand these challenges and are thinking of new ways of solve them. So I encourage each of you to take what you will learn and apply it towards building community resilience to enable responses that meet the needs of those most affected and the most vulnerable in our society. To the students, I'd like to close by saying how delighted I am that all of you have chosen to pursue your studies in public health. We need your creativity, ingenuity, drive more than ever. So congratulations to all the alumni medical officers of health, including, of course, Dr. Howard New, who's been working with me during all of this time, and other alumni from the school for your accomplishments and continued dedication to our field. I'm grateful and always impressed by your collective leadership, expertise, and collaboration to make a positive impact on the lives of people and communities across Canada and beyond. Thank you again for including me today, and enjoy the rest of the event. And I look forward to speaking with you again. Please stay safe and healthy. Thank you. Merci. Megwich.
Thank you so much, Dr. Tam. That was merci beaucoup. That was wonderful. We are absolutely thrilled and honored that you made the time to speak with us today during what is, I hope, possibly one of the busiest years of your life. So thank you very, very much. We appreciate it. We're going to move now to the Shah Award and to our special recognition of our medical officers of health. When we reached out to the list of graduates in the MOH role, we asked them to reflect on a single question. What has been your superpower during the pandemic? We've got some great answers, and we'd like to play a short presentation that shows you what some of those responses were to that question. Thank you so much. I hope you all like that. We wanted to think about how to present over 50 names, and I found that really, really fantastic. So thanks for watching that. I'm going to take a moment now to welcome Dr. Shah and introduce him. Dr. Chandrakant P. Shah's accomplishments and honors are too many to list here. We'll take the rest of the time. So I will just tell you what I know. He is an extremely determined and persistent advocate for equity and diversity in public health. He's a great supporter of alumni, and he has a delightful sense of humor and wit. Dr. Shah, it's a pleasure to know you.
Thank you, Jennifer, for that introduction. And Dr. Brown, fellow alumni, and also all the incoming students. It's really a great pleasure for me to say a few words, particularly for our award winners. To people living in Greater Toronto area, this year's Shah's Award winners probably need no introduction. Over the past year and a half, both Dr. Eileen de Villa and Dr. Lawrence Lowe have appeared in the news as frequent voices of calm and reason, reassuring citizens in Toronto and Peel that their respective health units were hard at work, doing their best to steer us through the pandemic. Say a few words about Dr. de Villa now. Dr. de Villa received a Bachelor of Science from McGill University, then went on to receive first a Master of Health Sciences, then an MD from the University of Toronto. She also completed a residency in public health and preventive medicine here at what is now the Dalla School of Public Health. She has worked as a public health physician since then. First in the Peel region, where she became medical officer of health in 2015. In 2017, Dr. de Villa was appointed medical officer of health for the city of Toronto, selected for her evidence-based approach to public health decision-making. Now, something about Dr. Lawrence Lowe. By coincidence, the person who succeeded Dr. de Villa as a medical officer of health in Peel is our other Shah Award winner this year, Dr. Lawrence Lowe. Dr. Lowe completed his undergraduate training and medical school at the University of Western Ontario, a Master of Public Health at Johns Hopkins University, and his residency at the University of Toronto. You may be wondering why the Shah Award is being given this year to two people rather than one. That's usual practice. The answer is simple. Both Eileen and Lawrence are both such outstanding examples of the qualities the award seeks to recognize. For your tireless and creative work, advancing the field of population health, seeking new ways to deliver public health services to those who need the most, and for your collegiality and warm leadership, I'm delighted to present the 2021 Shah Award to Dr. Eileen de Villa and Dr. Lawrence Lowe. Congratulations.
Thank you, Chan. And I think it goes without saying that now that I've now received from you 2 awards that bear your name, once as a resident and now, I would be remiss if I didn't also thank you for all the work that you've done in founding the Public Health and Preventive Medicine Residency Program at the University of Toronto, of which I'm a proud graduate, and certainly the same program that Dr. de Villa also attended. I know as well, and I believe it may not have been shared earlier, that unfortunately Eileen is unable to join us this afternoon. So I will take the opportunity to provide some remarks and look forward to our discussion. But I do want to say before I start my remarks, a number of thank yous, certainly to Dr. Tam, to Dr. Brown, also on the call. Really, I think one of the things that I've learned as an alumni of the school and with the cadre of alumni that we have in our across our country and across the world from Dalla, Lana, that we are truly we're truly fortunate, and much of my learning has really been being mentored by and working with and standing alongside giants in the field of public health. So I really want to thank the School of Public Health, especially the School of Public Health's Alumni Association for this honor. And I do want to recognize that while it is mine and Eileen names that will end up in the specific recipient frame of the award, this is not an award that is just ours alone. It really reflects the work of many hands of our colleague medical officers of health and associate medical officers of health across the country, and also most importantly, the entire public health workforce, the entire public health sector that has stood up here, even beyond the physicians that serve within these health units. I think it really, the success is not individual, and especially not so in a pandemic. And I will also say, in addition to the Dalla alumni that are around Canada, what is crystal clear to me throughout the course of this pandemic is that we have one of the greatest public health sectors in the world here in Canada. We have excellent expertise. We have incredible dedicated staff that have worked both within the civil service and within related agencies in government to make a difference and to make the tough decisions, as well as many other alumni and many other public health professionals from beyond those agencies and from outside of government who have tirelessly supported the overall effort and the response. So in thinking around and being asked to reflect on receiving this award today, I think the first thing I started out with was that I don't think any of us expected to be living through a pandemic in our lifetimes. I think we all studied it, we all anticipated it, and I think all of us have an interesting story out of just how we've all fallen into the day-to-day of this strange dystopian COVID-19 world, where we as a public health sector are collectively trying to save wholesale our entire society, and to preserve life and to preserve and minimize the impacts on our communities as best as we can. But I would like to venture to say that my pandemic story is perhaps a little more unusual than most. Simply put, I actually am still not quite sure how I ended up here at this time and at such a time as this. For those of you who don't know, my first day as medical officer of health on an interim basis at the region of Peel was March 14th, 2020. 3 days later, the province of Ontario declared its first state of emergency in response to the arrival of the first wave into our community. And it's interesting because I had actually, in graduating from Dalla, Lana, had this commitment and desire to actually pursue global health work. I was very engaged with a nonprofit organization doing work in the Dominican Republic, researching access to healthcare services for Haitian immigrants there. I worked with the World Medical Association on health human resources matters, and also creating the first platform for junior doctors, co-creating it with a colleague of mine in New Zealand and a colleague of mine in Germany and Sudan. And I was initially always saying, no, my main focus is more, looking globally, looking abroad, looking outside of Canada, as many younger, and as many people in their younger phase of their career, the earlier phase of their career may often be enchanted by. And I think over time, as my domestic career really grew and my, my family commitments at home started to take off, I always said, well, local public health work, it's where the fires are, it's where things happen. I maybe never have really had a penchant or interest for it, but if there's one public health unit that I would want to work for, just one, it would be the region of Peel. Because my connection with the region of Peel has stemmed essentially from my early career. I started out as a family doctor in Brampton, taking a year between my PGY2 and PGY3 years to take on a practice and actually consolidate my clinical skills. And then subsequent to that, I actually trained as a senior resident under Dr. David Mowat and Dr. Eileen de Villa at the Region of Peel. And I think there I really started to enjoy the work, the camaraderie, the approach, and also the community that the Peel Public Health Unit served. And so became quite enchanted with it and said, no matter what happens, I think I'd always like to enjoy working in Peel. And I don't know if this was just some sort of fit of final destination or otherwise, but somehow on March 14th, 2020, even though I had left global health behind and had been at Peel by that point for about 4.5 years and assumed the role after Dr. Jessica Hopkins' departure, global health came and found me. And I think it came and found all of us to some extent. And so I think in thinking about what we've all worked through with the pandemic, calendars that squeeze out every minute of every last day and a recognition that time is not your own, having to answer questions and especially answering questions with limited or evolving information, knowing that the answer you give today may be different tomorrow. I think there are a few things that I've had the opportunity to learn through the pandemic that are applicable to the broader field and practice of public health. And I offer this obviously humbly, recognizing that I am still relatively early in my career, and I will hold on to that title as long as I possibly can. I think the first thing that I've seen and learned throughout the pandemic is that context is ultimately everything. And I think there are a lot of things that get decided, a lot of advice and recommendations that may be offered, but ultimately it is public health that understands and knows that community and understands that that context can be different and needs to be different. The one thing that and the context is different and that the decisions need to be different rather. And the one thing that I would highlight is many cross-jurisdictional comparisons that occur, people saying, why aren't we taking an approach or why aren't we taking decisions the way another jurisdiction is? Why doesn't our picture look the way another jurisdiction does? And I think comparisons are helpful, but they only get you so far because the reality is, and especially in this pandemic, what we've endured in Canada is ultimately a different hand that was dealt to us than other countries and other places. And even within Canada, all of our jurisdictions were dealt very different hands. I think many of you are familiar with the challenges that we've had in the region of Peel, where it is not surprising that a disease that spreads from person to person will find more fertile ground in an area where there are more people densely packed together, and especially where extant disparities that existed long before the pandemic even arrived in your community ultimately will increase the opportunity for transmission, for the risks there too. So I think ultimately when you think about the different places that we serve as local public health and public health professionals as a whole, it is truly that incumbent function of public health to understand the jurisdiction that you serve, to understand the context, and to understand the evidence and data, but to make sure you're looking at all of the recommendations, all of the possible ways forward, and making a decision that is right for your community, for your province, for your country, because that ultimately is the function that we serve. There are lots of other ideas. There are lots of other ideas and lots of other approaches which may work for other places. But in considering the hands that we're all dealt and knowing that they're all different, we're the ones that are able to figure out how best to play our cards. I think the second thing that I've also learned is that, and it's not really learned, but maybe a revelation further, is that people really don't know what public health does sometimes. And to some extent, there are also people who think they know what public health ought to be doing. And I think this really challenges things in terms of our messages, our approach, or what we put out. I think throughout the pandemic, I've taken every opportunity to message to the broader community, to message to the public that this is public health and this is what we do, and also being very clear about what is not public health and what we don't do, but where we may need to rely on the expertise and the mandate of other partners to act. And I think in thinking around that and trying to get public health out there in a more encapsulated form that people can understand, I've landed on the idea that public health is ultimately the field that is concerned with health. Ultimately, a lot of people, when they think of health, they think about things like the healthcare system, hospitals, clinics, allied health, et cetera. But the reality is that, save and except for many clinical preventive services that are delivered in those settings, many people access the healthcare system once their health has been compromised. And I know I'm preaching to the converted here, especially to the Alumni Association, but health is what we start out with. And public health is the field and the profession that is most concerned with how do we create the context that allows people to maintain that intrinsic quality, that health that we are all given, for as long as possible and as well as possible. And so how do we continue to, how can we use something like the COVID cascade to really highlight that? That dire cascade that has been from infection to hospitalization to severe illness to mortality that has essentially plagued us throughout the course of this pandemic, ultimately represents the same cascade for every other disease entity and every other health problem that we face in our community. And we also know that the chances of people passing through that cascade are ultimately driven by disparities. The disparities that determine vulnerability into entering that cascade with COVID are the same disparities that determine our vulnerability when it comes to every other health issue that we're trying to address and that we are trying to essentially forestall in terms of negative outcomes. And so really, when it comes down to it, it becomes what we've endured through the pandemic, and the lessons that we've endured is, if you ultimately prevent and try to actually forestall that cascade by essentially creating more positive contexts that people may not understand, and people may actually have a significant opposition to what you're proposing. But the reality is as well that if you don't try to actually work with them, to bring them along, to help them understand why they need to get the vaccine, or why they need to distance, or why they need to mask, or why they need to adopt healthy behaviors, or why we as a community and as a society need to address social and structural determinants, then they face worse health outcomes. And they're also still, they also may still be unhappy with the advice that you provided. So I think it's ultimately about going against our individual desires at times, individual desires that we know are maybe not necessarily as productive or as able to promote health, and also looking at the context and environment by which those choices are actually provided to individuals, and really trying to highlight that public health is about shaping contexts. It's about shaping communities. It's about trying to give everyone that opportunity to maintain their health for as long as they possibly can. And ultimately, that is about trying to build collective action and working together. And so that really speaks to the third thing that I've learned and seen throughout the course of the pandemic, which is that I think we have an opportunity here. We have a really significant opportunity through the course of what we've undertaken in understanding the context of the pandemic in which our response unfolded, and really looking at how we evaluate, how we take the lessons learned, what we did well, because I firmly believe that we actually did fairly well here in Canada. I think compared to, again, staying away from interjurisdictional comparisons completely, but in terms of the decisions that were taken and the work that we as public health have done to try to balance the harms of unfettered viral spread against the harms of really harsh lockdowns, I think we've tried and we have managed to thread the needle somewhat well. And I'm also someone who always highlights that it is still way too early to call winners. I think a lot of people started to talk about jurisdictions that had done well as early as April and May 2020. And my response to them was, it's early, let's see where this goes. But in the course of our understanding of how the pandemic has gone in Canada, through the evaluations that we have, can we take the lessons that have been learned and basically start to really try to shift mindsets, use the prominence that public health has now to highlight what we were up against and how we can make things different, not just for COVID, but for every other health challenge that we know is waiting for us. Because Insofar as we know that many people are calling COVID one of the greatest health challenges of our generation, we also in public health know that that's not completely true, that we are going to be beset by numerous other health challenges that haven't gone away and that will still be on our desks to work on when we come back after the pandemic is over. So it is really about how do we take the lessons of COVID and how do we take what we have seen in our evaluation, in our lessons learned, in understanding our strengths, our areas for improvement, our areas for further resourcing and development, to address disparities, to engage communities better, to actually encourage society to see health as an asset we start out with and not something to be restored after it's been lost. And so for our current learners, I think, our current learners, the new learners that are incoming, and those that are early on in your career, this will be your challenge throughout the course of your career. For those like myself who are heading into the middle of our career, this is our priority to secure in the post-pandemic era. And for those of you who are in the golden years of your career, your advice and your wisdom will continue to lead and guide us. And ultimately, this is our collective effort as a public health community to really highlight that health is ultimately more than healthcare, and it is about the context that we build. I want to close by saying that there is a life after COVID. We know that we will go back to seeing many more health challenges throughout the course of our careers, and ultimately, what we have done and accomplished as a public health sector throughout the COVID-19 pandemic is going to stand us in excellent stead for that future state. And I'm looking forward to working with all of you and all of us coming together to continue making a difference. Thank you, and I'll pass it back to you, Jennifer.
I'm so inspired. Thank you so much. I don't think I'm not necessarily the intended audience, but that was absolutely fantastic, and thank you. So I have some questions for you, Dr. Lowe. As we know, unfortunately, Dr. Davila was not able to be here today, but we miss her a lot, and you're going to be fielding all the questions as a result. So I'll start with one sent to us. What is something that you would have done differently at the beginning of the pandemic, given what you know now?
I think the pandemic has obviously brought forward numerous challenges, and I think one of the biggest things that we identified in the Region of Peel was just how quickly and how significantly the impact of disparities drove transmission in our community. We were one of the first health units to start collecting data based on self-reported race and occupation. But I think to the extent that we ultimately have a role to play as public health in terms of addressing inequities and addressing disparities, and Chan, I know this is one of your one of your passions in terms of just recognizing that not all of us have a good opportunity for good health. I think for me, one of my challenges as an interim medical officer of health who came in just 3 days before the first wave lockdown, is that I didn't necessarily have as many connections into the community as I would have liked to have. And I'm really grateful that, the Peel, and again, I'm a big booster of Peel. I think it's a fantastic community, and it's one of the most diverse communities in the world. And I have nothing but thanks and gratitude to all of the community agencies that reached out to us saying, hey, we know that you guys are shouldering a heavy burden. We know that you're trying to figure out how to get to address the transmission in some of these communities amongst the marginalized, the vulnerables, our new Canadians, racialized populations, etc. And so I'm so eternally grateful that they reached out to me, very quickly. But I almost think that if I had to do it differently, I would have reached out to them first. I would have basically gone straight to them and said, hey, we're going to need all hands on deck. This is a whole community response. Once we were in touch, I think there was a lot of great stuff that we did together. But perhaps I would have reached out to them more quickly and more soon. Just, of course, when you're starting in a new role, there's a lot of stuff going on, though. So
Census that you did given I actually had no idea that that your start date, when you said that, I couldn't believe it. I thought you might have been about to say like the previous 6 months earlier or something.
No, absolutely.
Amazing. Another question, sort of picking up from what you were just from this, the issue of diverse groups. As we know, the impacts of COVID have varied across different groups quite widely. At this point in the pandemic, who are you most worried about? Who keeps you up at night?
I don't think there's any question of that. I think what keeps me up at night at this point in time are those that still haven't availed themselves of 2 doses of the vaccine. And I have to say, with the vaccinations, it's really a miracle of modern science. Just seeing how it's rolled out and how it's made a difference amongst the population in trying to reduce that cascade that I talked about. But yeah, I think at this point, anyone who remains unvaccinated is unfortunately taking a bit of a risk. It's like driving around without a seatbelt, especially with Delta in our community. And so to the extent that some of those individuals, to the extent that I'm speaking about them, but they're not necessarily a homogenous group of individuals that are choosing not to be vaccinated for the same reason. We know that there are access barriers. We know that there are, and there's a need to provide culturally sensitive and appropriate services. There's a need to conduct community outreach. So I think for us, it's about a race, about just trying to make sure that we're reducing every barrier we can, making sure that it's easy as possible for people not just to get vaccine, but also to get their questions answered, to get their concerns addressed. That's the one thing that we are firing on all cylinders to try to do in our community as Delta surges. And then also for those that maybe due to philosophic or other reasons, maintaining an open ear and empathizing, recognizing that, we may not see things the same way, but ultimately my message to them is still the same. The best way for them to protect themselves is with 2 doses of vaccine. And we are always willing to have that conversation whenever they're ready to.
Absolutely fantastic. That's it is. It really is a diverse group, as you say, and yet we're all in this together. So we really have to pull that. I think that's fantastic. What is one lesson that you think will guide future pandemic preparedness? You talked a little bit in your remarks about looking into the future, and of course, I mean, I imagine that for you it must seem like the present all the time because you're so busy, but to the extent that you've thought about the future.
So I really do think, and I think there's going to be a whole field in public health that's going to emerge out of this. But we have long known that misinformation, particularly misinformation, and the whole what did he call it? Not an information pandemic, but a syndemic, I believe it is, or something along those lines. The idea that many people are, especially with the creation of social media platforms, the opportunity for people to really create their own news feeds and their own content in this day and age. I think that really is something that I know has been studied extensively in public health, but will likely become even more important in prominence for future pandemic preparedness. And I think, again, going back to my remarks, the lessons learned around that have significant implications as well for all sorts of other public health campaigns. For example, around healthy sexuality or around active transportation or whatever the case might be. I think there are ways to learn about how people are engaging with their world, interfacing with their world and getting information. And then also how we can actually work with them to really use their trusted channels to make sure they're also getting information that is allowing them to understand context and understand what they can do to protect their health.
Yeah, that's a really interesting answer, because just as you say, I think the lessons even from say tobacco control are really applicable to thinking about how to approach these problems. I mean, that's what public health is, just as you said, and it really doesn't almost matter. I mean, it matters, but it crosses all these different issues. Here's a question we've just gotten from an audience member. how do you see this pandemic resolving or being under more control? The person's already limiting the question, given that there are still billions unvaccinated worldwide and constant mutations ongoing. It's a great question.
It's a great question. And I think the reality is COVID isn't going to go away. I think it's always going to be around. But I think over time, we've seen how many viruses will evolve to become less virulent. And we also know that as more exposures occur, either through vaccination or through natural infection, the risk of severe illness hopefully will start to diminish over time. Just that the virus essentially is not as novel as it used to be. I'll give a great example. When I was doing my master's in Baltimore in 2009, that was also the time where H1N1 was erupting on the world stage. And I think all of us in the public health field know that H1N1 still circulates every flu season. It's still there. Some variety of H1N1 is out and about. But thanks to vaccine formulations, thanks to just the tincture of time, it's not necessarily the novel threat that it was when it erupted on the world stage in 2009. And I'm hopeful that while COVID isn't going to go away, that maybe in 5-10 years as well, who knows, it'll just be part of the regular respiratory panel, along with the other cold coronaviruses that exist here and there. And one thing you wonder about is whether when those common cold coronaviruses that circulate every cold and flu season, how we've adapted to those now, but perhaps when they erupted on the world stage centuries ago, who knows? We just didn't have the wherewithal to track it, to detect it. Just some sort of heavenly wrath of something has essentially befallen our community, and subsequent to that, we evolved to move forward. I'm hopeful that that will be the fate of COVID, moving from pandemic to endemic in the future.
Yeah, that's great. And as you say, there's, I guess, a sort of a genealogy of all these viruses that we don't necessarily know about. And yeah, as you say, it just kind of keeps going. Has the role of MOH changed as a result of the pandemic? And if so, how do you think? And even looking forward?
Yeah, I would say the role of medical officers of health in general has not changed. Just the intensity of the work has changed, right? So medical officers of health ultimately are tasked with, with protecting, promoting, and optimizing the health of populations, and we do so with amazing teams at our public health units, leadership teams, frontline staff. This is not work that we can do on our own. But I think the big thing is just the level of work and the intensity of it has really shifted. I think I've probably done more media in the last 2 years than most medical officers of health would do in the course of a career. And I certainly credit our mayors for deciding that they wanted to have weekly press conferences for that. But I think it's all the same skills, and it's all the same mandate. It's about understanding your community. What is the health threat? What are you supposed to do to protect it? What's the context you need to build in order to preserve the health of your population? And then making sure you're monitoring it through surveillance, making sure you're putting measures in place through policy and programs to address them, making sure that you're communicating regularly to the community so that they're aware and they can take steps to protect themselves. Those are all the core functions of public health. Ultimately, they're just supercharged.
No kidding. Yeah. And so a kind of on that theme, sorry, I'm just making my little thing go away. What would you say, looking back at since we're talking to the incoming class and to alumni, is there any sort of skill set or learnings that you maybe wish you'd had, or think that you would advise future leaders like yourself to make sure you have going forward?
So I would say for anyone who is entering a public health unit or working really anywhere as a public health professional, the organizational management skills are something that it's incredibly valuable, but it's even more valuable in an emergency. And while I had sort of engaged, in things like human resources and budgeting and hiring and all these other pieces, it's not necessarily something that I had engaged in, significantly throughout the course of my early career. Now, you don't have to be an expert in it. I think you just need to know who you rely on. But you also need to have an understanding so that there's some receptor capacity when you're being told about, we need to hire these contracts, or we're doing this, or there's these policies or these things that kind of fit into place. Because ultimately that is the groundwork that allows the rest of the public health practice and work to unfold. Now, granted, this is also an unprecedented response and challenge. It's the longest response that the Region of Peel longest emergency response the Region of Peel has undertaken in its history. Almost 600 days worth of response at this point in time. And the sheer number of HR things, like we basically went from having 700 full-time equivalents to almost 3,000 full-time equivalent staff when you consider our vaccinations, redeployments, case management, contact tracers. So I take it easy on myself that I'm not necessarily able, because I think this is a Herculean task even for seasoned, seasoned managers and seasoned HR associates. But I think having an understanding of that really helps in terms of your leadership and management within an organization in the future. So anything to do with budgeting, HR, legal, ethical considerations, interest-based negotiations, conflict resolutions, workplace culture and safety. Those are all great things to actually pick up on, because you'll never know when they'll come into handy.
Wow. So we've gone from the kind of the general public not necessarily understanding what public health is, which I think is certainly true. I mean, I certainly experienced that when I was in public health grad school, and to talking about it. And I loved your sort of description of it as a contextual thing. But I think I hope my mom's on this call. I think it's. I hope everyone now understands that it's kind of like almost like it's everything. It's all the skills.
But if I could, I think it's all the skills, but it's also to the degree. I think one thing that I've gotten really good at in public health, and is actually knowing what I'm not good at, and I think that's the most critical thing. I call myself sometimes a bit of a recovering physician in that sense, because many people who go to medical school oftentimes come out and they feel that they kind of know it all because they've got the MD after their name. But because public health engages, and it's so multidisciplinary in terms of how it engages and with different professions and different agencies within the community, all these other pieces, I think as a public health physician, I've really learned to rely on the expertise of others, to listen and to really understand, to absorb and understand and incorporate into as it fits into my expertise, rather than trying to impose a specific view. And I think that's actually stood us in really good stead throughout the pandemic as well.
That's leadership is knowing when to when to hand it off to, right? Yeah, that's fantastic. I think we have time for just one more question. And I have this one. What is one tough lesson that you've learned during the pandemic?
So I think the toughest lesson that I've learned throughout the pandemic is that you have to make a decision no matter what, right? To not make a decision is making a decision as well. And in a situation where you have, you can sit there and have analysis by paralysis, and wait for more information, wait for more data. That stuff's always evolving. But the reality is, when lives are on the line and when things need to be done, sometimes you have to take the decision. And I will let you know that not everyone's going to like that decision. But the ironic thing is that they're not all going to not like that decision for the same reason. I think many of the decisions that I've taken, for example, I've had people who thought that decision went too far. I've had other people who thought that decision didn't go far enough. And I would always say, if you are trying to, gut check a decision, chances are, if you are getting shot at from both sides, you're probably on some pretty solid middle ground. And hopefully that means that the decision you've taken is a little more serviceable than moving to the extreme. So the big thing is just you need to make sure and I've learned that I've never been shy to take a decision, but being able to see how it actually plays out and knowing that you have to act when you have to act, I think that's been a tough lesson to learn.
I can only imagine. And we know also that making decisions when you're under stress is that much harder and that much more it can become paralyzing. So I can only imagine. Thank you so much. This is, we are going to close now. So I want, on behalf of the PHAA, again, to convey our sincere appreciation to all our alumni medical officers of health and to their hardworking teams. And actually something that I wanted to mention, when Dr. Shah and I were talking about this in the previous weeks, he mentioned, and I think it's really worth reiterating, and Dr. Lowe, you said this as well, it's a huge team of people behind even the medical officers of health who are working hard and who are making these amazing impacts. So a huge shout out to all of you, especially to our award winners, Dr. Dalla, who we're so sad can't be here today, and to Dr. Lowe, thank you so much for doing it all. To Canada's Chief Medical Officer of Health, Dr. Teresa Tam, tremendous honor to have you here. To Dean Brown and the rest of the school, who are always helpful and great, and to Dr. Shah for generously supporting this award. So thank you all so much. We really appreciate it. The Public Health Alumni Association hosts events and activities that are open to everyone, alumni or not. And we're always eager to hear from alumni who want to become involved. In fact, we are growing our board, and the deadline to apply to join our team has been extended until next Monday at midnight. We're a fantastic group, if I do say so, and we would love to have all of you alumni on board. It's a great opportunity, so I hope you'll consider joining. And again, thank you to all of you so much.